Amid the COVID-19 crisis and the possibilities of a shutdown in Lagos, we spoke with the president of the Nigerian Medical Association, Dr. Francis Faduile, assessing the readiness of healthcare workers in dealing with this pandemic. Hello, can you hear me clearly, sir?
Very well.
Okay, that's fantastic. We have had cases in Italy where we are hearing the number of deaths really increasing. We hear health workers at the front line getting really tired and them having to decide on who to save and who not to save. And we look at the peculiarity of our case here where we have just 40,000 doctors according to the NME. If this pandemic, if it goes into a way worse situation, do you think that the doctors we have, the health workers that we have, will they be enough to be able to fight this battle?
Well, for us to be able to adequately fight this battle is not all doctors or all health workers that are properly trained to take care of these cases. We need extensive training for those who are on ground. We need extensive provision of the personal protective equipment, the PPE. You see a lot of people putting on normal face masks. The face mask you needed for treatment of COVID-19 is not that type of face mask. It is a face mask that is a special one that is called N95 face mask. If you don't have that, I doubt if we have any health personnel that will want to go and help in the treatment of this patient. Again, it is important that all the PPE, the personal protective equipment, are available to those who want to treat them. And it is when you have those that you can say we have enough for the health personnel to treat. But the major problem we have is that over years, the health system in the country has been under perennial shortage of funding, and it has made the health system very weak. And I can tell you, there is not much that you put on it that will not affect the stability of the health system. How many respirators do we have? How many isolation rooms do we have that can take care for this treatment of this patient? These are things we need to look at and we need to work extensively upon. And what Nigerian Medical Association is advocating is to make sure that we do not lose any of our members from this deadly disease while treating other patients. And how do we ensure that? We need to ensure that by making all doctors and all health workers who need to treat these patients to be appropriately kitted and done in the normal PPE to treat them. Otherwise, it will be difficult for you to send them to treat those who are infected without getting those PPE ready for them to protect themselves and their family that they will need to get back to at home.
It's remarkable because some markets are still open, you have some places still crowded, and there are some people moving around in crowded public spaces and even dampers and buses. And it begs the question that should Lagos actually go on a lockdown?
Well, thank you very much. I think what we're having is the government having some cold feet in taking the right decision. Why am I saying this? The Nigerian Medical Association came out about 2 weeks ago and advised the government that it is important for Nigeria to stop all flights and close all the borders. Because we realize that the health system in Nigeria is weak, and it is better for us to prevent COVID-19 to come to Nigeria than to attempt at treatment and containing it. Because as it is with us now. And it is because a lot of people brought it down from those countries that they have this COVID-19. As at present, most of the cases of COVID-19 is in Lagos State. We have few in FCT, Abuja, at Oyo State and Ekiti State. It is imperative for us to stop this COVID-19 from going to other parts of this country. And what we really need to do is to lock down Lagos. Stop every person in Lagos from leaving Lagos for the next 40 days so that we can mop up all the cases of COVID-19 within Lagos. And also, we need to stop the transmission within Lagos by stopping every area that we see people gathering, including markets. And I think that is the right thing we should do so that we can change this virus as quickly as quick as possible.
All right, sir. We're getting a bit of noise. I don't know where it's coming from. Okay, it has stopped actually. So now it brings me to my next question. The measures put in place by the NCDC and the Ministry of Health, do you think they are enough? You know, telling people to self-isolate, telling people to report cases, and we're hearing that even these days the call centers are being overwhelmed, and some of them can't even attend on time to some of these people. So, do you think the things put in place actually by the NCDC and the Ministry of Health, do you think it's enough? The measures put in place?
Well, I want to say that Nigeria does not look as if we are well prepared for this case. And if we are not well prepared, two things or some things may actually stare us right at the face. The first one is for us to understand how much of the test kits that we have within the country. One, for the BCL level 3 and above that can do these tests, we know that there are very few within the country. There's nothing you can do. You cannot open a laboratory within this period that we have the epidemic or pandemic in our hands. So, in that respect, we may not be able to appropriately get the diagnosis of patients who may need this diagnosis. Again, it is also important for us to also know that what the things we needed to contain it to distance self-isolation. For Nigeria being, which is highly dense populated area, many people stay in a building that one room apartment and you have 5 or 6 people staying in that place. How can you self-isolate yourself in that area? We have a lot of people bedroom, the same kitchen, and you want them to self-isolate. It may be very, very difficult. And it is not because it is not the ideal thing, but it is because of the peculiarity that we have in this part of the world. So I think while it is the desirable thing, is the recommended thing from the government, and in treatment of COVID-19 generally, it may be very difficult for us to have that Nigeria as being very, very useful. Self-isolation is great, but it might be difficult for us to ensure that in country.
All right, thank you so much for talking to us on Guardian TV. We are absolutely grateful that you made up time to talk to us.